Hi, I'm Jane O'Donnell, health policy reporter with USA Today. I'm here today with Dr. Anthony Fauci, who's the director of the National Institute for Allergy and Infectious Diseases. Dr. Fauci, coronavirus, of course, has been in the news so much. People are worried. Should they be worried? Are they worried unnecessarily? And what should they be doing?
No, I don't think people should be frightened. I mean, the risk right now, today, currently, is really relatively low for the American public, but that could change because what's going on outside of the United States, particularly obviously in China and in other countries in which there are travel-related cases, that this could evolve, and I think it would be unrealistic to deny that, this could evolve into a global pandemic, which would then have significant implications for us. So although we don't want people to be worried now, I think we need to realize that this could change. So right now, don't worry about it. Be more concerned about influenza, which is going into a second peak for the season, than coronavirus. But keep in mind that the coronavirus situation could change, which is the reason why we're taking it very seriously, because it could be a substantial threat. Right now, we're still in the middle of the flu season, and for flu, you get vaccinated, you wash your hands as frequently as you can, you avoid crowded places where people are sneezing and coughing. That would help protect you against influenza. And if and when, and I hope it's more if rather than when, if we get substantial coronavirus here, those kinds of typical, simple public health measures could help protect you against coronavirus. People wearing masks now is just not relevant. You don't need to be walking around with a mask right now. Masks, quite frankly, are more important for people who are infected to prevent them from infecting someone else.
And hopefully they would get a better mask than the drugstore sells?
Right. The drugstore masks that sell have a lot of loopholes in them that let the virus through.
Okay. So wash your hands repeatedly. Right. You don't need a mask, and just avoid crowded places where everyone's sneezing. Okay.
Precisely.
Was it a mistake to quarantine the people inside the cruise ship?
Well, I don't think we can categorize it as a mistake or not a mistake. The Japanese authorities who did the quarantine on the ship when it was in Yokohama Harbor felt that with the quarantine there would not be spread from person to person. Obviously and unfortunately, that process did not work, and people who were quarantined on the ship were actually getting infected, and there was a substantial amount of infection, which is the reason why, when you got infected, you were taken off the ship and put in a hospital in Japan. But as people continued to get infected, the decision was made to get people off that ship and get them back home in a safe way.
Could you quickly explain the 5 cities and which 5 cities
Sure.
CDC is testing in and why that's so important?
Right. What we're trying to do right now, we know we have 15 cases in the United States, 13 of which are travel, 2 of which are the spouses of travelers. We're not having, to our knowledge, undetected spread within the community. But in order to make sure that we're not having that, what the CDC has done is they picked 5 sentinel cities: New York, Los Angeles, San Francisco, Chicago, and Seattle. And what they're doing is when people come in with symptoms of flu, but who test negative for flu, they're also testing them for coronavirus to see if there are people out there who are having symptoms who really do have coronavirus, even though there's no well-known connection between someone who traveled to Wuhan and came back here, or who is coming from Wuhan. If you get a sampling, you can get a pretty good idea of whether or not we're missing cases. That would be really important, because if we are, then that really changes the complexion of what's going on. We'll know that reasonably soon. They're starting the testing imminently.
Mm-hmm. And should people be hoping for a vaccine to help solve this problem?
I believe we're going to have a vaccine, because we're going into clinical trial for phase 1 within the next couple of months. It will not be for at least a year or more until we know a vaccine works, even though this is the quickest we've ever done of going from identifying the virus to going into a clinical trial in human. But still, to have a vaccine practically available for people should be well over a year and a half, at least at the earliest. So right now, the countermeasure to stop this is much more classical, simple public health measures: identification, isolation, contact tracing, quarantine where appropriate. Vaccines will be relevant if we go through a cycle where this comes back next year and the year after. That's where vaccines will be important.
And finally, are you getting what you want from the Chinese government?
Well, in the early, the early weeks, we did not get the kind of information that we would have liked to gotten. But right now, it looks like the Chinese government has really realized that they'd better be transparent, and they're telling their own people to be very open and honest. So I think right now, today, we are getting the information we need. We're having people who will be part of the WHO contingent that will be going to China to have eyes, ears, and boots on the ground. Hopefully, if they're allowed to take a look at what's really going on, we'll get a direct feedback from our own people.
Terrific. Thank you so much for being with us today.
Good to be with you.
For more information, go to usatoday.com.